Dr. Rainey, it's a pleasure to have you back on the show. You always bring such interesting things to tell us, and I've gone to the dentist my whole life, but I never thought there was so much involved in dentistry and the equipment and water. Water came out of the thing that they sprayed in my mouth, and I just thought that's all there was to it. So you've been working on some projects that involve ozonated water.
Absolutely. That's where my focus has been in the last 2 or 3 years. Working in that particular arena.
And what is ozonated water?
Okay. Ozone, people get the misconception again that ozone could be bad for you. But ozone is your body's natural defense against microbes. Microbes cannot change, cannot mutate to have a defense against ozone. That is your natural defense. Once a microbe penetrates a cell wall, one of the mammalian cell walls, any mammal cell walls, then the first line of defense is that cell will release ozone, which will kill the microbe.
The bad. Oh,
Yes.
I see. Like E. coli, something that serious?
Absolutely. It will take E. coli in 15 minutes. It'll take E. coli in 15 seconds. Pardon me, it'll take E. coli down to 99% less than it was.
Wow.
And at some point in time, your body can handle an influx of E. coli. How does that compare to Clorox?
Ugh.
If you rinse your hands with Clorox, in 1 minute, you can reduce the E. coli by 15%.
Not worth the smell. and the ozonated water has no odor, no
none.
smell.
None whatsoever.
Well, we thought we'd talk a little bit about trays. This would be for people who have one of the units at home, not specifically a dental office, but you use trays.
For home, because when we dentists provide the home trays, patient can take it at home, and we want to do our treatment in the dental office. We want to do 4 treatments. This is for somebody who has an autoimmune disease, somebody who is susceptible to decay. Autoimmune disease being MS, being rheumatoid arthritis, diabetes. There's over 170 functions that the ozone will upregulate. And one of the ways that we take care of the pathogenic bacteria in the mouth is with the ozone tray. What we do in our office would be take a 60 cc syringe, fill that syringe from our ozonated water dispenser, put it into the syringe, have the patient bite down on that.
There's just the one tray, not two,
there'd
like
be
for
2 separate.
braces or
It's a little cumbersome to try to do them both at one time.
I see.
Okay, so you put it in, you have a custom tray, you slowly expel it over 15, 20, 30 seconds. So now then you have every surface in your mouth super saturated.
So do you have to
ozonated
leave
water.
it in there for 20 minutes or something like the whitening?
Part of what we do is air slurry polishing. We want to strip off all of the plaque on the teeth, which the patient can do a pretty good job of doing with the water pick type of appliance and oral irrigator with 1 gallon of water, 1 cup of baking soda. If they did that first, then the ozonated water can only penetrate so far. Okay, so if you have plaque, food debris, whatever on your teeth, it's not going to be anywhere near as effective. Okay, that's one reason why we want to do 4 in a row, once a week in our dental office.
There's no pain involved.
Absolutely none, particularly with this unit because we're starting out at room temperature. So you have room temperature.
So even
water.
if you have sensitive teeth, you're not going to notice it.
That used to be a serious problem because we had to use refrigerated water to generate the ozonated water. So this one is going to use room temperature water. Whatever temperature of the water is that's coming in is going to be what we're using in the syringe and in the mouth.
Is there any time it's not safe for patients, somebody that maybe has a certain condition?
Absolutely not. This is one of the simplest procedures that we provide for our patients.
And you have, this is the home unit, of course, but through your practice, you've had this ozonated water designed to come into all over people. Your front office people even wash their hands with it.
Right.
And patients that are sitting there sick maybe, or will be treated before they get to the dental chair.
Right, we want the front desk, when they come in, to come in to the laboratory and then wash their hands with this, okay? Now then, anytime we are transferring any type of record, written record to the front desk, then we want that employee washing their hands with ozonated water so we're not transferring bacteria from the front to the back.
Even if they're wearing those plastic latex gloves?
If your hands are contaminated when you put those latex gloves on,
Oh.
your hands are contaminated
They're
when
still
you take them off.
contaminated. I see.
So then the latex gloves are going to be highly contaminated, of course. So anytime that the assistant, the personnel are transferring anything to the front desk, we want their hands clean to begin with.
Well, it makes sense in a dental office, and that's what you're especially concerned with. But it sounds like there's lots of other offices, professional offices, that a machine like this providing ozonated water would be very helpful.
Oh, absolutely. Well,
It's just getting the word out.
Yeah, think about the industry out there. How many people are working in the restaurant industry, in the healthcare, and any type of healthcare out there? Every single individual could benefit from this, not only for the patient's benefit, but for the benefit for themselves. It's going to drastically reduce the potential for cross-contamination.
And we talk about cross-contamination a lot with food, you know, not putting chicken on the cutting board and then immediately slicing the broccoli or something like that. But I hadn't thought about water being able to be cross-contamination.
Well, absolutely. You can get contaminated water coming out of your water taps. We constantly have boil water only alerts in South Texas. I think we've had half a dozen probably in the last 2 or 3 years that something's happened to a water main somewhere, and they actually catch it. So how many of those
How many
things,
they don't catch.
right? How many do they not catch? So this has so many applications in so many areas, in the medical industry, the healthcare industry, of course, in produce, anybody handling produce, restaurants. How about grocery stores? What about restrooms where people would go in and wash their hands with this? They eliminate 99% of the E. coli on their hands in 15 seconds compared to if you wash your hands with Clorox.
And how many of us sit there for 2 full minutes washing our hands? It seems like an eternity.
The best we're going to do as human beings is go in and rinse our hands. Period. So why not rinse your hands with something that's actually effective?
And how long does it stay ozonated, if that's the right term?
It depends on the concentration coming out of here. We want the ozonated water coming out of the home unit to last at least a half hour to an hour because we want people using it immediately. Now, for the medical and dental professions, we radically increase the amount of ozonated water, the concentration of the ozone in the water, so that it is still therapeutic 4 and 5 hours down the road.
And then overnight, I assume the units are just still working 24/7? And
They work through a 30-minute cycle. They're always purging themselves. Once you plug one in, you can only reset it 30 times before it says no moss.
no moss.
It'll cut itself off, and you have to go through a series of tests to make sure that you haven't damaged the cell on the inside of it. So we don't want it going off. In our rural area, that's one thing that we have to worry about constantly. We had a power failure last week, so we have these plugged into an UPS unit just like a computer.
Generator or something.
And then the secondary generator can kick in.
Lots of excitement going on in the medical field and in the dental field, and I appreciate you coming and telling us about it. And there's a lot of information on the website, and people can go to your website and learn much more than we had time to discuss.
Well, thank you very much. What we're trying to do is raise awareness, and if you want this type of treatment, the best way to get it is to ask your dentist.